Hello everyone, today I really want to address a serious issue which a lot of women have been complaining about. That's having all the signs and symptoms of pregnancy. They have missed their periods and they are doing a pregnancy test and it's still negative. What is happening? I've had a lot of messages from my YouTube channel, from my TikTok channel, on Facebook, and I really need to address this issue properly. So I'm going to be talking about what can make you have all these signs and symptoms of pregnancy, and or you miss your period and you do a pregnancy test and it's still negative. What is happening? What are the common pathologies we're going to be talking about? What are the various causes? And lastly, what can you do next? What are some of the signs and symptoms that if you see this, you might be thinking that, hey, it might be this condition and not pregnancy? And when should you visit your healthcare provider? So please take your time. This video is a detailed explanation of all the various things. So grab your coffee, grab water, grab tea, and stay concentrated till the end of this video. It might help you or even help another woman out there. So don't miss out on this episode. This is Talk Pregnancy with Dr. Noella, where we tell you all about pregnancy and other women-related health issues. And if these are the kind of content you like to watch, why not click on that subscription button? Let's dive right in. Welcome back. Now we're going to start. First thing, once you miss your period, it's very normal to think of pregnancy, because the first thing we think about in any woman who comes to the hospital to consult and send menses, the first thing that we think about is pregnancy until proven otherwise. But now, this is a situation where you do your pregnancy test correctly, assuming you know how to do it correctly, and made a complete video on the step-by-step method on how you should do a pregnancy test. So assuming that you did the pregnancy test correctly, and maybe if it was not conclusive, another person did it to be sure that you did it. Even more, you did a blood test and even an ultrasound scan and there is no baby, and your pregnancy test is negative, and you're still having the signs and symptoms of pregnancy and your period has not yet come. This is what we are talking about. Now we are going to divide these things into, because cause hormonal imbalances and others which does not directly lead to hormonal imbalance. The first and the most common one is stress. I bet you stress can really affect your period. You see someone who is very stressful, and maybe it's not really like having just a bad day, no. Okay, like people who have been having, maybe like thinking of getting pregnant and hoping that this next time they should get pregnant, that's a long time of stress. People suffering from infertility, they have had a long time of stress. So if your period does not come that month, it's like, oh, this is pregnancy, you get it? So that's an accumulation of stress, the psychological and physical stress. So it's not just about your thoughts. You might be very stressful doing a lot of things. So this is accumulated stress, which can disrupt the production of the gonadotropin releasing hormone. Now I'm just going to go back a little bit so that you know the cycle. Once you know the cycle of how ovulation and your menstrual cycle comes about, it's very good. So it's just a little bit of biology, but it's good for you to understand so that you know how your menses comes about. Normally what happens is that it starts right at the level of the brain. We have the gonadotropin releasing hormone, which is secreted at the hypothalamus in the brain. This hypothalamus at the brain therefore stimulates the anterior pituitary gland to release two hormones. That's the follicle stimulating hormone and the luteinizing hormone. These are all still in the level of the brain. These brain hormones now, this luteinizing hormone and follicle stimulating hormone, what do? They're to stimulate the ovaries to produce estrogen and progesterone. So that's just the normal cycle. So any condition that will affect this axis, therefore, is going to affect your period. Now, stress, what does stress affect? It affects the gonadotropin releasing hormone. That's at the level of the brain. So you see that stress at the level of the brain affects that, and once it is affected, therefore all the other hormones downs are affected. So it can make you to have a delayed menses and a delayed period. Therefore your pregnancy test is going to be negative. So if you actually see that it's stress and it's more of counseling that is needed at this level. The second is exercise. Exercise, how does it affect you? Walking for 1 or 2 hours per day is very okay, but when you tend to do a lot more of exercise than what you consume, so you see that when you do more exercise, you burn a lot of calories. It affects the pituitary gland and also the thyroid glands. Causes a changes in that area, so it can also affect your menses. Normally, if you're an athletic, you do a lot heavy workout, you have to visit your sports physician. You see that they're going to balance you up with your meals with other vitamins so that you don't have a lot of burnout, and there are other things that can substitute what you're going to be losing. The next one is excessive weight gain and excessive weight loss. It influences the level of estrogen and progesterone. If you don't eat well, or if you lack these photons, therefore hormones that had to be produced normally will not be produced well. Like for example, if you're eating properly and you usually produce for example 10 these hormones, now if you're not eating properly, it will produce hormones, but it might produce now 5. So you see that the rate is going to be distorted. So therefore, more than balance exercise. If you're exercising, then at least you eat well. So even if you want to reduce in your weight, there are methods which you can balance them up with other vitamins. So we have other pathologies, other diseases that can actually cause these hormonal imbalances. The first is what? PCOS, that's polycystic ovarian syndrome. Polycystic ovarian syndrome is something which is really common than we think. This is because many people usually have it, but to diagnose it, it's not always easy. What is polycystic ovarian syndrome? The cause is really unknown, but what does it lead to? 3 things which is associated with polycystic ovarian syndrome. You have irregular periods, suffering from infertility, and lastly, you have male characteristics in your body because of the hormone androgens, which are usually produced in cases of polycystic ovarian syndrome. So what's more peculiar about the irregularities? You see, maybe you might be having your period, you see it now, you can wait 2, 3, or even 4 months before the next period comes, and when the next period is coming, the bleeding is very, very heavy. So it's almost like trying to compensate for the other 3 months. So that is peculiar about the irregularities of the period, because there are some other ones where you have it irregular, and even when it's coming, it's still spotted. So this one, it comes heavy. Then you might see that you have hair here, a lady having hair on her chin, having hair on her chest, and with all that might be also associated with infertility. So if you have these 3 things, you might start thinking that you have polycystic ovarian syndrome, and there's actually a treatment for that. So you need to go and consult so that it can be confirmed if it's polycystic ovarian syndrome. And when they say polycystic ovarian syndrome, it means there are many cysts, like fluid-like structures at the level of the ovaries. So when they are at the level of the ovaries, it affects ovulation. So that is polycystic ovarian syndrome. It's a whole thing on its own, and I made a video concerning that. So after this, you can go back to watch what polycystic ovarian syndrome is, how can you treat it, because it causes infertility. So now the next one is use of hormonal contraceptive methods. Yeah, this one is a very, very, very common one. If you use hormonal contraceptive methods, we have the pills, we have the combined oral contraceptive pills, we have the Depo-Provera, we have the implants. So, and even the hormonal intrauterine device, that's the Mirena coil. So there, because there are 2 types, the one that is copper and the one that is not hormonal. So if you use the one that is hormonal, those are the ones that cause changes, because you already have your normal structure, you have your normal system of normal flow of your hormones in your body. When you bring in another one, it will therefore disrupt. That's why some people, when they start taking these hormonal contraceptive methods, you can start having mild bleeding or heavy bleeding or absent menses. It's very, very normal. But normally you have to go for a follow-up. If it's ones which you are not comfortable with, they can change. And if maybe after 1 or 2 months it becomes regularized, then that's fine. But it's very important to go for follow-up. And normally once you stop taking these hormonal contraceptive methods, it might stay in you for some time before it actually is treated totally. So after just immediately taking contraceptive methods, you can still have irregular periods before it becomes regularized. Now the next one, menopause and perimenopause. Yes, perimenopause is the transition time from your reproductive age to menopause. There you tend to start having, you usually have your normal heavy bleeding. Now it starts becoming light, associated with other factors like hot flushes, dryness of the vagina. And how does this affect? Because average age of getting into menopause is 45 to 55, but sometimes women even get into menopause, that's what they call early menopause, at around 35 to 40. So you see that. And nowadays a lot of women tend to go to school, look for great jobs career wise at 35, 34, 40. They've never gotten married and they're still hoping to have children. So I've even made a video too on what are the consequences of getting pregnant at these later ages and what should you do before you get pregnant. So don't forget to go back and watch this video. Now, if early menopause is coming, you might start having these symptoms. But if you start having, you miss your period and you start having these symptoms of hot flushes, dry vagina, mood swings and all that, so you see that with this kind of thing, you might be thinking of pregnancy, whereas it is menopause that is coming. The other one is women who just start seeing their period for the first time. That's what they call menarche. Once you see it for the first time, remember this axis starts from the brain and it goes to the ovaries. It's not yet well regular. So it's very, very possible to have irregular periods for the first 2 years. It's very okay, but sometimes after these 2 years it should definitely be regular. But if it doesn't get regular, then you should consult, and you might start having, they might start checking to see if there's a problem, or in future you might start having this, or if you have to conceive in future, do like this. So it's very important that you know, in women who start seeing their period, maybe you see this month, the next month it doesn't come, no problem. The next month, and you do the pregnancy test of course and it's negative, and the next month it's negative, it doesn't come and it comes again. So you can just see and you manage and just see that okay, this is because the axis is not yet mature. Lot of other things, that a lot, having a severe disease, you're suffering from any chronic disease, you're having maybe cancer, and maybe you're even bedridden. So all these things can affect your period. You might see that people who are always sick and bedridden in the hospital, stay in the hospital for 1-2 months, you see that they hardly see their periods. So it's just because of the stress during that time. Breastfeeding too can make you not to see your period, because that time you're breastfeeding and your system is not yet really back to normal. But normally what happens is that breastfeeding helps your period not to come. And people who do exclusive breastfeeding for 6 months and they have not seen their period, it is very, very normal. So it is because this is what they call the lactational amenorrhea method. So it just helps you. But once you start seeing your period, you should be able to see it monthly. But even if it does not come, remember you are just from giving birth and your system has not yet come back. Like your hormones can still be irregular. Also thyroid diseases. Now there's also what we call the psychological problem. We cannot discard that. There are people who want to get pregnant, and once they miss their period, oh, they are very sure that it's pregnancy, and even in their mind they have all the signs and symptoms of pregnancy, but it is not pregnancy. So you need more of counseling in that case. Normal to miss one period or 2 times, and it's okay. It's also normal for your period to delay by 3 to 4 or even 1 week, and it comes once in a while. Remember that if you have a cycle, the normal cycle is 28 days, but your cycle can range from 21 days to 35 days. So if you have a cycle in this range, know that it is normal. Once your cycle starts going out of that, start thinking that there might be a problem. But once in a while, you can delay, your menses can delay for 3 to 4 and even a week. And if it comes and the next month it comes normally, the next one it comes normally, then there is actually no call for a concern, because you know your system changes. As you grow older, things changes, you're exposed to a lot of things, so your period cannot just be exact all the time. If you're facing this kind of situation, you've done the test series of times and you see that it is negative, and if your period has not come 1 month, 2 months and 3 months in a row, please consult your healthcare provider. There might be a serious issue, and there might just be simple explanation and treatment for that. Remember, also infections such as sexually transmitted infection can delay your period, so it's very important you know that. Thank you very much. I hope this was helpful, and if you want to have a private consultation with me, please click on the link on the description box and you get to me. Don't forget to subscribe, share and like, and God bless you.